I'm gonna perform the anterior drawer test. So I'm gonna grasp the heel and I'm gonna push down on the tibia and pull up. Just like this. And now for posterior drawer, I'm gonna switch my hand placement and I'm gonna pull up on the tibia and push down on the talus. Now I'm going to perform the subtalar tilt. So for inversion, I'm going to grasp the heel again. Do this. And then for eversion, again, that's the subtalar tilt. And now for the Kliger test, I'm going to grasp underneath the tibia and brace my elbow against my body like so. And then grab underneath the first MTP and do a rotational moment into eversion. And again, you can do this in dorsiflexion, neutral, or plantar flexion. And I want to make sure that the tibia is stabilized while I'm doing this. And then finally the clunk test, I'm going to stand medially and I'm going to place one hand again above the talus and then another above the malleolus, and I'm going to create a shearing action. Now I'm going to perform the Thompson test. So I'm going to grasp the gastroc and give it a firm squeeze. Okay, and then for the Tittle sign, I'm going to have the patient flip over. Can you please flip over? Okay, and I'm going to bend the knee like this. And I'm going to feel for the fibular head and feel for a cord-like structure, which is the peroneal nerve. So I'm going to dig down deep back here. And then once I found it, I'm going to give it a good firm tap, like so. Now I'm going to test the range of motion, and we're going to do plantar flexion and dorsiflexion. So I'm going to take my stabilizing arm and stabilize it here against her leg, and I'm going to take the middle of the radius and put it in the joint space right here, like so. So to start, we're going to do dorsiflexion, and I'm going to have her foot at 90 degrees to start, and then I'm going to have her actively bring her foot towards her face. So we moved about 10 degrees there, and then I'm going to push it passively, and it went about another 10. So for plantar flexion, we're going to do the same thing. So bring the foot to 90 degrees. Then I'm going to have her actively push her foot down. Good. So that went about, we have 60 degrees, and I'm going to passively push it down. And it went about another 20. Okay, now I'm going to test the range of motion for inversion and eversion of the ankle. So I'm going to place the radius of the goniometer at the ridge of the subtalar joint right here. And then I'm going to stabilize up here, the stabilizing lever arm. Then I'm going to grasp the heel down here with the movable lever arm. And I'm going to tap on the outside of the patient's foot, which way I want them to move first. So for eversion, I'm going to tap out here. Then I'm going to have them actively move their foot. So that went about 5, and then I'm going to passively push it, and that went about 5 more, so we have 10 degrees overall. And then for inversion, we're going to start back at 0, and I'm going to tap their foot, I'm going to have them go inward. So go ahead. Went about 5, and then if I passively push it a little bit more, I went about another 5, so 10 degrees.